Hello, Professor. Good afternoon. This is your student, Leslie Bradley, and I'm going to do my final exam. The topic that I chose is PTSD, which is also known as post-traumatic stress disorder. In my video, I will talk about the diagnosis, biological and environmental, which is nature versus nurture, treatment methods, my view on it, psychological and physical symptoms of PTSD. And PTSD stands for post traumatic stress disorder. It is commonly known as a psychological disorder, and it's categorized by an anxiety disorder that affects those who experience and witness a traumatic event. Again, later on in the video, I will list what some of those traumatic events could be or would be. And so I know I've done mental health for a little over maybe 10 to 11 years, and I've never associated PTSD with in the behavioral health field or mental health field. I always thought that it was with war vets or Vietnam vets, people that served in the military that had saw things. Never thought that it was so mainstream. So what is post-traumatic stress disorder, you ask? It's a mental health disorder that transpires among those who have experienced or witnessed a traumatic event in their life. And the statistics of that is 7 to 8 million citizens in the U.S. suffer from that, the highest being 10% of women, and next would be 4.5% being men. The highest for women, due to the fact that we tend to report things, we tend to go see our physicians and doctors when situations or issues come up that we don't feel comfortable with, whereas men, it's known that they don't. They kind of run from that, or not go and get help. So that's why the percentage is low for men. Some of the symptoms of PTSD could be in the psychological symptoms, negative changes in thoughts and moods, changes in emotional reactions, nightmares, intrusive memories, which is flashbacks, and avoidance. And for the physical symptoms, you can have fatigue, rapid heart rate, headaches, a change in physical reaction, weakness. For associated behaviors, wide range, emotional outbursts, social withdrawal, isolation or separation, change in activity, increased in consumption of alcohol or any drugs, and that would be to try to ease the pain. I know in 2007, I was raped, and so how I eased my pain, I turned to food. No drugs or alcohol, just food, which also can be very tricky as well. And so that was a very traumatic event for me, being raped. And I'm better now. I have dealt with that. There are a lot of online assessments that you can take for PTSD or to diagnose yourself, but it is always better to go see your physician, your psychiatrist, psychologist, and get the proper diagnosis. You can have blood work, CT scans to get the right diagnosis. It transpires, the official diagnosis transpires if you've had the symptoms for 1 month or longer by a psychiatrist or a psychologist. And these are doctors qualified and able to diagnose you. After getting the official diagnosis, there are also maybe other tests that could be completed, such as blood tests and CT scans. It's not exactly a self-diagnosable disorder, but again, you can take online assessments if you choose to take that route. So nature versus nurture with PTSD. Biological is physical assault, witnessing people being hurt or killed, living in a war zone, a serious accident. I mean, with the George Floyd thing going on, you can, I have showed my son and he's 10, the video, he's seen it, heard it, talked about it. That can be very traumatic. It is very traumatic. We all witnessed someone being killed with this event. For environment, it could be earthquakes, bushfires, floods, volcanoes, wildfires. Those things can also have traumatic stress on a person's life and mental state. The treatment methods for this is psychodynamic treatments. It first originated alongside the psychodynamic theory, in which there are 4 major schools. The 4 major schools are ego psychology, objective relations, Freudian, and self-psychology. Within the psychodynamic perspective, psychodynamic theory is also known as talk therapy. I mean, what better way to deal with this disorder other than talking? You can talk and get it all out on the table and get some advice from a psychologist or psychiatrist. And all in all, this therapy helps you become self-aware, and that's what you need, is to be self-aware, and so that you can know your triggers, your stressors with this disorder. This course has affected my views in psychology and in mental health. Psychology, just being able to learn more about the theorist, B.F. Skinner, Sigmund Freud. Yes, I was very happy to take this class. I feel like it will help me in my everyday life. It will help me pursue now my bachelor's degree after this. And I was very excited to help this class. I maybe one day want to open up a clinic dealing with PTSD so I can help individuals that deal with this. Again, Professor, thank you so much. I enjoyed taking this class and look forward to learning more about psychology. Thank you so much. Bye-bye.